You have a potato nodes in the chest X-ray, and there are thick lesions, lupus pernio. So this is a case of sarcoidosis. The Schwann bodies, asteroid bodies may be seen, but they are not pathognomonic of sarcoidosis. You can get hypercalcemia, hypercalciuria, and increased level of angiotensin converting enzyme, etc., etc. Now, transudative pleural effusion versus exudative pleural effusion, you must know the list of causes, what lead to transudative, what lead to the exudative, and what is the criteria before you call it as Light's criteria of classifying the pleural effusion. These are all very repeatedly, routinely asked a question. If you did wrong, then definitely you need to relook as to how I am going to remember and reproduce in tomorrow's exam the long list of the causes. Very, very important. A 37-year-old has undergone liver biopsy, and typically this kind of chain of lakes appearance is there with sclerosing cholangitis. So this is an example of primary sclerosing cholangitis. It can be associated with inflammatory bowel disease. And periductal fibrosis typically involves the smaller bile ducts. That's what you need to appreciate. Insulinomas, they are encapsulated, they can be found in MEN1 syndrome. What do you find in MEN1 syndrome? Pancreas, pituitary, and all the three central organs. Pituitary, pancreas, and parathyroid, so which are all central organs. So mostly it is single, not multiple. Enucleation is considered to be the treatment of choice, is what need to be remembered. Hypersensitivity pneumonitis has different names. They are not inorganic dust, they are the organic dust is what you have to basically appreciate. And there is an increased amount of CD8 positive T cells in the bronchoalveolar lavage. And very acute severe cases, oral steroids can be tried out for about 3 to 4 weeks. So they are all the true facts. So you can see here the classical hypersensitivity pneumonitis, how it looks like. And farmer's lung, bird fancier's lung, humidifier's lung, moldy hay, etc., etc. So you should be sure on hypersensitivity pneumonitis topic. The mouth is dry, repeated dental caries, and lymphocytic infiltration of salivary glands. What does this remind you? The classical clinical vignette. It reminds you of Sjogren's syndrome. So it is the females who are more frequently affected than the males in case of the Sjogren's syndrome, is what you have to basically remember. There is a lot of lymphocytic infiltration. At one point of time, Sjogren's syndrome patients can have increased incidence of lymphoma. They can have renal involvement. They can develop arthritis. Often there is a confusion whether the arthritis is purely a case of rheumatoid arthritis or is it a Sjogren presenting like that, is always a challenge. So Felties has got neutropenia, not neutrophilia, as all of you know very well. There is a splenomegaly, a long-standing rheumatoid arthritis, etc., etc. as a part of it. In HIV, what do you have? CNS lymphoma, cervical cancer, Kaposi sarcoma. So there are a list of gynecological malignancies recognized to be associated with the AIDS, is what you need to remember. Hypercalcemia is associated with the squamous cell carcinoma, not small cell carcinoma. Also you will find it in breast cancer, prostate cancer, non-small cell cancer. They are all associated with hypercalcemia. One question invariably comes on different types of immunodeficiency syndrome: Job syndrome, Chidiac-Higashi syndrome, severe combined immunodeficiency, etc., etc., which you have to be very sure about. There is an increased risk of infection with pneumocystis jirovecii and You can give adenosine deaminase. Stem cell transplantation is a part of the treatment. It can be both X-linked recessive or autosomal recessive. They're all the features which are associated with severe combined immunodeficiency. Proximal RTA, which is the type 2 RTA, and the distal RTA, which is the type 1 RTA, you must know all differences. Definitely one question will be asked. So you can go back to our video library. Many times we discussed the topic of Liddle syndrome, Bartter syndrome, Gentleman syndrome, type proximal RTA, distal RTA. So please download YouMedico app or visit anatomytomedicine.com. You have got the video library. Many times we discuss in the medicine lectures. So you must know the list. Amphotericin, collagen vascular disease, cirrhosis, nephrocalcinosis, multiple myeloma, type 1. Whereas hereditary causes, sulfonamides, carbonic anhydrase inhibitors, pancones, multiple myeloma, they all can cause proximal RTA. Then diabetes and hypertension, main reason for the type 4 RTA, and chronic interstitial nephritis, aldosterone resistance, they are the causes for the type 4 RTA. You have to be doubly sure. All renal tubular acidosis are hypokalemic, but not the type 4, which is hyperkalemic, is what you need to basically remember. So I don't go too deep into this because this requires pen, whiteboard, Ramayana, and we have to start from a long, right from Treta Yuga. We should start discussing Dwapar Yuga, Treta Yuga, abhi Kali Yuga mein hai. 2019 ka NEET PG aa gaya. We had been discussing this topic since 1999. So, favorite topic of the examiner. You require a little bit of analysis, understand the topic. There are small reasons why oxalate stones are more in case of the renal tubular acidosis. Which type of renal tubular acidosis are they more? All these things you have to thoroughly discuss, which is available in the video library. Normal anion gap versus high anion gap metabolic acidosis. Favorite question. Non-anion gap, you find it in renal tubular acidosis, diarrhea, ureterosigmoidoscopy, hyperalimentation, estrozolamide therapy, etc., which you have to basically remember. Now,